Today we are going to start about MCQs of the viewers regarding the aging. And our first MCQ is the autopsy of 78-year-old man demonstrate decreased left ventricular cavity size and the sigmoid shear ventricular septum. Light microscopy shows increased collagen content within the ventricular wall. Some myocardial cells are having brownish perinuclear cytoplasmic nucleus. The changes described are most consistent in which of following condition: it is hypertrophic cardiomyopathy, ischemic heart disease, it's long-standing hypertension, normal aging. But if you remember about the aging portion of general pathology, you guys remember in cardiovascular system, in normal aging, they will increase the size of atrial cavity. Atrial cavity size increased and ventricular cavity size decreased. And they are having sigmoid shear ventricular septum. That all the things are related to normal aging and brownish perinuclear cytoplasmic nucleus and lipofuscin. These all are characteristic of normal aging. If you guys guess, it's the age of 78-year-old. Okay. Whenever any MCQ, any question, there will be age of above 60 to 70. You should have to consider the normal aging process also. This is a diagram regarding the young heart and the old heart. In the young, if you guys focus the normal here, this is the size of a cavity. This is the size of cavity of atrium. But here the size of cavity decreases. The ventricular cavity size decrease, but the atrial cavity size is increase. And also, if you guys see the size of septum, it is increased. Here it's very low, but there is a hypertrophy of the segment. And there is a dilated aortic root. And these are main concern and the main features of normal aging in cardiovascular. If we move to the next question, the next question is: a 78-year-old man dies to advanced esophageal cancer. The man's family donates his body for teaching purpose and autopsy is performed. Age is 78-year-old man. Gross examination for heart reveals left ventricular chamber size and wall thickening within normal limits. Non-significant atherosclerosis is seen in coronary arteries. On microscopic examination, myocardial cells demonstrate prominent yellow-brown intracytoplasmic granules. As shown in the exhibit, which of the following most likely account for observed microscopic changes? Guys, these are down. These are the brown they come. Correct? That is showing in the slide. It's a cardiac myocytes. If you get focus, intercalated rings. The cardiac cells, and they having that brown pigment. It's a lipofuscin. Lipofuscin is also one indication of aging. Yes. So what will be our right answer? Right answer would be lipid peroxidation. Not exogenous pigment endocytosis because inches and heat. Glucose polymerization, no. No. Why it's the glycogen and glucose polymerization product that typically appear clear vacuoles within the cytoplasm, not the brown and yellow intracytoplasmic granule. It gives clear vacuoles. If you talk about the iron gives the hemosiderin like macrophages in which iron containing brown pigment called hemosiderin, often seen in area localized iron overload that caused by the plating and tissue decompensatory heart failure, causes the leakage of edema and enterocyte into lung parenchyma, and hemosiderin-laden macrophages can be seen. But all the things are very normal. If you guys check the gross examination of heart, lungs, all the things are okay and fine, but There's a yellow color pigment intracytoplasmic ring that physiologically it is present due to itching and it's due to lipid peroxidation. So there's yellow-brown pigment within the cytoplasmic granules is also the residual bodies. In this man, myocardium represents lipophilia, and lipophilia is the composed of lysosomal breakdown process. Lysosomal breakdown products. And second, include the lipid polymers and protein complex phospholipids that result from the free radical entry in lipid or oxidation. That are indicating lipid peroxidation and free radical entry. These are important points, and the insoluble granules are considered and the wear and tear products that accumulate with the age, and they are commonly seen in root and organs like heart, liver, central nervous system of the adrenal glands. All the okay. Now we have to move to our next question. Our next question is, a 78-year-old man is being evaluated for the headaches that are delivered over the counter acetaminophen. He takes no other medication and is lifelong non-smoker. The patient's blood pressure is 180/70 and the pulse 75 per minute and regular. During a pure office visit, blood pressure was 175/60. Physical examination shows S4 but is otherwise unremarkable. The CT scan of height reveals no significant abnormalities. Which of the following age-related changes but best explain the patient blood pressure readings? First of all, this is not a conceivable thing because he having the age of 78 years old. In older people, the S4 is normal. Secondly, the most common thing due to aging increasing atrial collagen deposition. In physiological aging, there is deposition of all collagen in the atrial wall due to the increase in blood pressure. We also have one table in which they all the mentioned physiological age-related cardiovascular changes. In aortic stiffening, the elastin is replacement with the collagen. Elastin going to replace it. Collagen, there is a pulse pressure increase due to isolated systolic hypertension. There is a mild concentric left ventricular hypertrophy that is response to cardiomyocytes, and they are having the resting AF, SV and cardiac output, and there is the maximum cardiac output will be decreased. Conduction cells and degradations. And you have a reduced in bioreceptor sensitivity and adrenergic response. He did not respond as a elder person, and the elder person not going to respond as much as a young person can respond. So it is very important point. In the older patient, there will be decrease in adrenergic responsiveness, reducing bioreceptor sensitivity. So there will be increase in aldosterone, decrease in heart rate and contractility responses. Okay. And the thing, the patient blood pressure reading show, if you again see this question again, this patient blood pressure reading show a pattern of elevated systolic blood pressure with a relatively low diastolic. Systolic is increasing and diastolic is decreasing. And the pulse pressure consistent with isolated systolic hypertension. And isolated systolic hypertension is often seen in elderly patients that have an age more than 65-year-old. And it is representing the 60 to 80% of hypertension cases in this population. And aging is associated with increased aortic stiffness caused by endothelial dysfunction and change in extracellular matrix composition. That is a replacement of elastin with collagen. You guys already know all the things. This is the main concern. What is isolating? Systolic hypertension. When the systolic blood pressure is high and the diastolic pressure low, like here. Okay. This is an accelerated systolic hypertension that is common in elderly patients having the age more than 65 years old. Now we move to our next question. Our question is, a 50-year-old woman who had a mild myopia for decades comes to the office with a routine physical examination. The patient had no chronic medical condition and eats a healthy diet consisting of a variety of organically grown foods. She is excited because she rarely had to wear glasses or contact anymore. Her visual acuity at week 20 is 20/13 both eye without reading her glasses, which of following condition has physical etiology as the changes caused this patient visual improvement. Guys, in this, the main condition, they are saying that woman having myopia, but with the time, the myopia is automatically, spontaneously resolving. Why myopia is resolving and eyesight getting better? And the reason having same etiology with which of following factor? In that, if you guys check, the age is getting 50. It is moving toward aging. So the improvement in this patient mild myopia is likely due to age-related changes. And you guys already know age-related changes, the most common thing is skin wrinkles. But normally in accommodation and focusing on near objects, ciliary muscle contraction relaxes the zonal fibers allowing the lens to become more convinced so the image focus on the retina. Also having one diagram, I will show you here. Yes, this is the myopia. In the myopia, the images focuses in front of retina. For the normal imaging, they have to focus on the retina, but in myopia, it's in front of retina. But in presbyopia, the images are focusing behind the retina. That is due to aging. It is due to aging and this disease is present that woman. But when both going to combine, like it is in front of retina, it is behind of retina. When both making a sum, if you can say its effect, it will can say its effect, and it will make a compensation. The myopia and presbyopia, they will make a compensation, and now images are going to focus on retina. Are you guys understand? Then in myopia, the image is going to show in front of retina, but in presbyopia, images are focused behind the retina. But when we combine both diseases, myopia and presbyopia, if we make compensation, and then now image is going to focus on retina and eyesight become better in that moment. I think now it is understand. But they are saying due to reason, which reason the eyes are getting better due to presbyopia, and this is due to aging. But indeed, all of them, which one is related to aging is skin wrinkles. The answer is skin wrinkles. Now we are moving to our next question. Our next question is, cell biologist is studying the role of ribonucleoproteins in a normal cell function. He prepared a cell extract using a specific cell type obtained from 73-year-old man. Ribonucleoproteins are separated and purified from the cell extract for structural and functional analysis. These cells are found to express higher amounts of particular proteins in comparison to other cell types. This protein has reverse transcriptase activity that functions to add TTA-GG repeats to the 3 of chromosome, which follow cell type was most likely studied in these experiments. The TTA-GG is a code that is added by telomerase. And if you guys know about the Telomerase, it is a ribonucleoprotein. The ribonucleoprotein that adds this code TTA, GG, and repeats to the third end of chromosome. Already they mentioned that all the thing, third end of chromosome on the telomere region. It is free and similar to other reverse transcriptase enzyme in that it synthesizes single-stranded DNA using single-stranded RNA as a template. Telomerase is a composed of two main neurons, and the telomerase reverse transcriptase, and second is telomerase RNA component. Telomerase RNA component. These two are subunits of telomerase. And telomerase RNA components are built-in RNA template that is repeatedly read by the TERT subunit to add TTAGG DNA sequence repeats to telomerase. But in that they are asking, in 73-year-old man, he take two type of cells. And in one cell, you find there is a rapid growth. They having the higher amount of particular proteins in comparison to other cell types. Why it is happening like that? They took both cells and all the cells from same body, from same human being that having the age of 73-year-old, but one cell is providing more protein than the others. So what is happening? If you guys know about the aging also depends on genetic. If you guys remember, there was in aging session there were three things: genetic, pre-genetic, and metabolism alternation. That were the three things on which the aging are going to depend. But in genetic there is one thing that was telomere shortening. The telomere shortening is just happening by the cell is going to divide, but in somatic cells and a stem cell. In somatic cells like neurons, pancreatic beta cells, myocardial cells, all other cells short their telomeres. Okay? The most of time when it is differentiating atherosclerotic cells, myocardial cell, neuron, pancreatic beta cell have short telomeres and they not express telomerase, and the telomere shorten with every cell division. In every cell division, it will become shorter. So these cells provide less protein in the experiment, but the stem cells having a quality usage, the stem cell undifferentiated cell with the potential to differentiating to other cell types and can be classified as other embryonic or other stem cell. In their stem cells, there is no shortening of telomere happening. So they having the long telomere. The somatic cells having short telomere with aging, but the stem cells having long telomere if we compare with other cells. So in these all cells, the epidermal basal cells are stem cell, but the erythrocyte, myocardial cell, neurons, these all are somatic cells. So these all having short telomere. Yes. All having these all having short telomere, and the stem cell epidermal bases are having long telomere. Therefore, it produces more protein than others. And this is the same sequence I already told you, TTAGGG. Okay? And this is the enzyme telomerase, that is reverse transcriptase. Now we are moving to the next question. A 79-year-old man is brought to the hospital due to confusion for the past 2 days. The patient has nausea, decreased appetite, poor oral intake for several weeks. He has also mentioned that everything around him has a yellow tint. He has no abdominal pain. Medical history include long-standing heart failure, dual ejection fraction, and atrial fibrillation. Medication include metoprolol, digoxin, lisinopril, and apixaban. The patient is afebrile, blood pressure 130/80, pulse is 58 per minute, abdomen is soft and tender, no rigidity, rebound, no mass is present. Age-related changes in which of following factors most likely account for this patient's symptoms. So if you guys know, intestinal absorption will be decrease. Okay. Liver enzyme activity decrease. Muscle mass decrease. Plasma protein binding will be decreased because liver function will be decreased, and renal clearance will also decrease. That all the symptoms that is showing is a digoxin toxicity, and you guys know digoxin is going to eliminate from the body by the help of kidney. So due to renal clearance, these all symptoms are coming. If you guys know the clinical manifestation of digoxin toxicity, that life-threatening arrhythmias. In GIT, there is anorexia, nausea, vomiting, abdominal pain, and neurologically there is a confusion, color vision alternation, like everything is showing yellow tint. The patient is complaining, he having weaknesses and fatigue. This is all about the digoxin toxicity, and due to clear renal clearance, this is happening to this lady. And for that, the dose of digoxin must be reduced in older patients. Now we are moving to the next question. A 3-year-old boy is brought to the office for a well child visit. Her mother reports that apart from an ear infection last year and a good health, the child started preschool this year. He plays with other children and often copies what they are doing, but does not play make believe like his older sister. The patient knows his age, sex, can speak in 3-word sentence. He can ride a tricycle but can't hop on one foot. The patient can't use a spoon and fork, enjoy eating with his hand. He scribbles spontaneously but can't copy a circle. Which of the following developmental milestone is likely a delay in this patient? Cognitive, fine, gross, language, and social. Guys, for all the things, you have to know in which category which things are there. For example, in the gross motor, the child have to pulse to the stand, crosses, take few steps, and he have to walk easily, climb off the chair. He have to run, kick ball, walk stair. He have to jump, and he have to walk up the stairs with the alternating feet, and he have to ride the tricycle. He is 3-year-old boy, and he is able to ride the tricycle as they are mentioning in the question. So it is not the gross motor. Now we are moving to the next, that is the language. Says mama, dada, understand, no. Say 1-2 words, say more than 3 words, say 2 words, say more than 50 words, say greater than 3 words, and sentence be 75 intelligible. In which he said that is a well and a good health, and he is a preschool mean. And secondly, he can speak in 3-word sentences. As they are mentioned, they are saying 3 or more than 3 words. So language is fine, so answer is not language. Now we are check the fine motor. Fine motor, pencil grabs, stick to blocks, feed with finger, uses spoon, and remove closed 10 pages. You have to dress this with help and use fork and copy the circle. The same, he is a 3-year-old and his mom is complaining that he is unable to draw the circle. He is unable to use fork and spoon to eat the food. So answer is fine motor. These all the things are included in the fine motor. And that cognitive, he knows the area and he play with other children. He knows and he play with other children, so he is good in social activity and he good in cognitive. So answer is a fine motor. In the age of 3, the baby had to enjoy the food and eat with his hand, with a spoon and a fork, and you have to copy a circle. Fine. Now we move to the next question. The next question is, a 63-year-old woman come to the office for a routine preventive examination. She has no significant medical problem, no medication. The patient consumes balanced diet, regular exercise, no tobacco, alcohol, and drugs. She up to date on breast, colon, cervical screening. Her physical examination findings are unremarkable. The patient expressed concern about the wrinkles around her eyes that make her void, and decreasing which of following is most likely responsible for this patient complaint. The patient is 63-year-old. You have to tell about age-related things in the answer, and we have to give the reason about which is thing is going to decrease, so the wrinkles is going to happen. You guys already know elastic degradation. The elastic degradation have to increase, not the decrease. Okay, so answer is not elastic degradation. Now the collagenase synthesis. The collagenase synthesis are going to increase. The metalloproteinase enzymes are going to increase. So the main answer, the good answer is collagen fibrin production. The collagen fibrin production will going to decrease, so they are unable to protect the skin. And mostly they happen to the multiple environmental factors, special exposure to ultraviolet light that they contribute to aging of the skin. The ultraviolet light wavelengths are predominantly absorbed in the upper dermis and contribute to sunburn and increased risk of malignancy. You guys know this type of aging is called photoaging. Photoaging means due to sun exposure, and in which this led to decrease the collagen fibrin production along with upregulation of matrix metalloproteinases, include collagenase enzyme that will be increases, and there will be subsequently degrade type 1 and type 3 collagen and elastin. So due to which the wrinkle is going to happen. So right answer, collagen fibrin production will be decreases, and collagenase synthesis will be increases, and elastic degradation will be increases along collagen 1 and 3. Okay. Now we are moving to the next question. The next question about a 81-year-old man come to the office after the upper respiratory tract infection. His symptoms have largely resolved except for a mild non-productive cough that is especially bothersome at 9. Medical history includes hypertension and knee osteoarthritis. The patient is still physically active and plays golf on the weekend. He is a retired insurance executive and has no known environmental exposures. He has no history of smoking. Physical examination is unremarkable and chest x-ray is normal. Permeable functioning testing is considered in this patient. Compared to midlife, which of following changes are most likely expected as a result of normal aging in this patient? We have to tell about the lungs condition and all about age-related factors. Age-related factor. What is the effect on total lung capacity, forced vital capacity, and residual volume? If you guys know, in the aging, the total lung capacity remain unchanged. The forced vital capacity will be decreases along the forced expiratory volume in 1 second. It will also decrease it. And residual volume is going to increase because expiratory volume is decreases. So as the expiratory volume is going to decrease, there will increase in residual volume. And that is the answer. Our next question is, a 75-year-old man is hospitalized due to respiratory distress. The patient developed fever, cough, and muscle aches. What is your transmission? So guys, if you from the onward or the question, we are going to read from the last statement and then we will catch the question. So which of the following factors most likely increase this patient's risk of vaccine failure compared to that of the son? Like that patient having 75-year-old man, he is saying if you're comparing him with his son who is young, this is the following factor is risk of vaccination failure. So if you guys know, they decrease overall quality of antibodies is not like that. There is decrease in production of nerve B lymphocytes, yes. Because there will be decrease in red pulp, there will be decrease in bone marrow, there is decrease in production of B cells. So this condition also is an immunosense, aging of immune system, due to which the vaccine is going to fail in all person as compared to young patient. We are also having diagram immunosense means aging of immune system. In that, the T lymphocytes with naive CD4 T cells will be decreased and memory CD8 will be increased. If we talk about B lymphocyte, the production of naive B cell will be decreased and no change in antibody quality. This is an important point. There is no any effect on antibody quality, but there will be decrease in B cells. Natural killer cell decrease in cytotoxicity and cytokine production. And second, if we talk about macrophages, there will decrease in phagocytosis and response from cytokines, because the patient is going to decrease in sensitivity. And due to aging, the body response is going to decline. If we talk about the neutrophils and neutrophil chemotaxis, if we decrease in phagocytosis also in free radical protection also decreases. Dendritic cells, antigen presenting capability will be decreased and cytokine production will also decrease. In all immune system, everything will going to decrease except the antibody quality. There is no compromise in antibody quality, but everything is going to decrease. Next, we are going to the same technique. We have to read our last statement, then we will move to our second last, and you will go from a start if you did not get the question. Which of the following age-related cardiopulmonary changes is most likely to increase this patient mortality risk? They are saying, which of age-related cardiopulmonary changes is more likely to increase patient mortality risk? Like in age-related, a lot of changes will come in their human body, but which of following change will increase the risk of mortality? So we have two treat options. Decrease the cardiac adrenergic response, decrease left ventricular wall thickness, and there is a decreased ventricular perfusion mismatch, there is an increased diaphragmatic strength, increased large artery compliance, increased lung extreme surface area. These both things are right. There will be decrease in adrenergic response. You guys know already we are and learned this all the thing in upper MCQs in cardiovascular changes. There is a decrease in adrenergic response and there is a decrease in left ventricular wall thickness. There increased in left ventricular wall thickness but decrease in cavity. Okay. There is a decrease in ventricular perfusion mismatch. No, there is an increase in VQ mismatch. There is a decrease in diaphragmatic entrance. There is an increase in large artery compliance. Therefore, decrease in large artery compliance, so there will be increase in stiffness. And there will be decrease in lung gas exchange surface area. So right answer is decreased cardiac adrenergic response, due to which the patient will not respond to adrenergic stimulus and the body will not overcome that situation. Already we are done with that. They were in aortic stiffening, the elastin is displaced with collagen, there is mild concentric left ventricular hypertrophy, there will be conduction cell degradation, and there is reduced adrenergic responsiveness, reduced baroreceptor sensitivity. Now we are moving to the next question. The next question is, which of the following age-related process best explain the observed finding? What are the findings? The physiology conducted a study to evaluate the erythropoiesis, in which of the studies healthy individuals who experience acute traumatic blood loss are enrolled. They divide the patient into groups. Younger individuals with the mean age of 35 years and older individuals with a mean age of 70. These patients have normal iron, folic acid, and vitamin B12 and plasma proteins high. Results indicate that older patients with acute traumatic blood loss have much lower reticulocyte count, a much longer time to recovery to pre-trauma hemoglobin level when compared to younger patients. Which of the following age-related process best explains? Guys, they are having results. They having all the patients with acute traumatic blood loss have much lower reticulocyte count. So what are the reasons? There will be decrease in bone marrow mass, decrease in medullary cavity size, decrease in red cell lifespan is not like that. It will be remain constant. And there is an increase extramedullary hematopoiesis? No. Increase metaphyseal tissue? No. There will be decrease in bone marrow mass. We already studying in the aging chapter, there will be increase in fat deposition. Fat deposition in bone marrow, and there will be decrease in bone marrow mass. That was active mass that are going to produce RBC in cells. So the right answer is decreased bone marrow mass. This is effect of normal aging process. Therefore, in the younger and elderly period, there is a decrease in reticular count in elder people. Our next question is, a 32-year-old woman comes to the office for the medical evaluation. So which of the following age-related renal changes should be taken into consideration when assessing donor suitability? Whenever you are guys going for the donor suitability and he has the same blood group and you are going, the patient still has 26, has a renal failure. The thing is that the young person have get the renal failure and that woman is going to donate her kidney to his son. But we have to think one thing. In 62-year-old woman, there is some renal changes, aging changes, the normal aging changes happening in her kidney. So what are that? Increased sensitivity of renal release? No. There will decrease sensitivity. There will decrease renal blood flow. There will be decrease in creatinine clearance, decrease fluid excretability. No, there will be decreased number of functional glomerulitis due to decreased number of nephrons. The number of nephrons is going to decrease, so there will be decreased number of functional glomeruli. So we have to consider this thing while donating her kidney. Okay. Now we are moving to our next question. The next question is, it is about standard deviation and it is about the biostatistics. A study was conducted to assess the age and the menarche among the young female, and based on commitment to the sports, children were divided into two groups and the recreation children, in which they are giving the data of competitive and the recreation. Competitive sample size is 16 in the mean 13.4 and standard deviation 1.3. In this question, we have to give the menarche in the normal distributed, which are following the closest to the probability that a randomly chosen competitive gymnastics will have onset of menarche at the age of 16. We have to tell about the competitive gymnastics having the menarche, how much probability it is, how much chances of them having menarche at the age of more than 16 or age of 16. So if you guys know about that chart, this is a normal distribution of our society. Gaussian distribution. Actually, it is a symmetrically bell-shaped distribution with a fixed percentages of observation lying within a certain distal mean, and distal is called standard deviation, like this, and this. It is standard deviation. We have to, first we have to get the value, the mean value. The mean value is 13.4 and having the mean of 1.3. Mean is 13.4 and standard deviation 1.3 plus and minus. So what is happening? We have to put standard deviation. When we put a standard deviation, we have to get a sample size of 16. Okay. If we put one standard deviation 1, then the answer come in the range between 12.1 to 14.7. If we then go with two standard deviations, mean multiply by 2. If you multiply by 2, 1.3, it will be 2.6, and answer will be there 10.8 to 16. So how much we have to get? The sample size 16. So in this distribution graph, we have to put two standard deviation, and you guys know in the standard deviation, second standard deviation is related to 95% and first related to 68%. In this graph, in the 95%, remaining is 5%. Remaining is 5%, in which these chances of 2.5% chances of 10.8, and there is chances of 2.5 of 16. So our answer will be 2.5 divided by 100. It will then come 10, and answer will be 0.25. Okay. It is just a question biostatistics and statistics. When you guys are done with that subjects or public health, and it will be more easy for you, but it is just like that. And don't forget, in the first standard deviation you have in 68% of data, in second deviation you have in a 95% of data, and in third deviation you have in a 99.7% data. Now we are moving to the next question. Our next question is, a healthy 80-year-old man has participated in the longitudinal study over the past 30 years and studied the effect of aging on all over cardiovascular states. Which of the following children is most likely responsible for the preserved left ventricular ejection fraction in this patient? So, he is saying here undergo annual testing with echocardiography and left ventricular ejection fraction had remained stable. But which of the following factor is going to be responsible for preserved left ventricular ejection fraction in this patient? Yes, cardiomyocyte hypertrophy is there. Increase atrial reserve capacity, increase left ventricular compliance, increase left ventricular diastole, stable ventricular myocyte number. Oh guys, it will be cardiomyocyte hypertrophy. Why it is going to happen? You guys know the cardiovascular system undergo array of age-related physiological changes, and over time cardiomyocytes are lost to both apoptosis and necrosis. So there will be no stable ventricular myocyte numbers. Okay, resulting in over reduced cardiomyocyte number. The loss of ventricular cardiomyocyte weaken contractile strength, and in addition the aorta and other large arteries stiffen with the age. So when they are going to stiffen with age, they are having decrease in compliance. So when they are going to decrease in compliance, then they are getting more stiff, and they will be reduced atrial reserve capacity. So it will be not the answer because they are saying increase. And the increased left ventricle afterward to compensate for the cardiomyocyte loss and increased afterward. Cardiomyocyte hypertrophy will be there. There is a mild concentric left ventricular hypertrophy, and this occurs allowing for the maintenance of left ventricular contractility and ejection fraction. Our next question is, an 80-year-old man participated in a study designed to evaluate the effects of aging on the liver. So which of the following histological changes has most developed over time in this individual? Excessive amyloid deposition, hemocytin collection within the hepatocyte intracytoplasmic line inclusion, lipofan deposition within the hepatocyte, or chelate collagen. That's a very common question, and you guys know that it is lipofan deposition with the hepatocyte because it's a physiologically normal aging process. The lipofan is normal deposition. The amyloid can be effect for the aging, but most commonly due to any disease, and also disease for the fat process. But it is the most common normal physiological deposition, lipofan. In we having the table in which there is the effect of aging on the liver, the anatomic changes are decrease the liver size and the due to decrease hepatic perfusion. Taking what are the physiological changes, there will be decreased regenerative capacity, decreased activity of cytochrome P450 to decrease in metabolism. There will be decreased proteins, albumin, clotting, photosynthesis, and histological changes. There are increase in hepatocyte size, increased polypolarity, and accumulation lipofuscin, that is brown atrophy. So it is all about the liver. And if you guys and talking about a healthy person, so there is no changing amino transferase enzyme. When you are doing the LFT is normal, no change in enzymes. Okay, if the person is healthy. We're having one more question. Seems like 87-year-old woman come to office to discuss the treatment of colon cancer, which was recently diagnosed with colonoscopy. It is scan negative for metastasis. The patient has no other medical condition. History is unremarkable. She does not drink alcohol and vitals are normal. Chemotherapy containing medication that is primarily metabolized by liver and chosen for therapy. Because the patient needs, the physician consider adjusting the dose to prevent the adverse effect. Which of following parameters likely to be more similar between this patient healthy 40-year individual? The same thing I already told you in previous question. They are asking which of the parameters are same in elder patient and the young patient. So you guys know the hepatic concentration will be decreased. The liver blood perfusion will be decreased due to decrease in size. Rate of hepatic regeneration will be decreased. The size of liver also going to decrease. You guys already know that all the things. But there will be no change in serum aminotransferase level. There will be no changes aminotransferase level. Because the number of changes occurring in liver with aging can be affected with metabolism. Typically, changes include decreased liver mass, blood flow, decrease of cytochrome P450 expression concentration, and reduced hepatic regeneration after injury. However, hepatic aminotransferase levels are unchanged. This is a very important point. Now we move to our next question. Next question is just about respiratory. The 80-year-old man has been participating in longitudinal study of aging. He has no major medical condition. Atrial blood gas samples are obtained every decade on room air at sea level to monitor long-term change in pulmonary gas exchange. Compared to 30 years ago, which of the following results is more consistent with normal aging? We have to tell about A gradient, PaCO2 and PaO2. And secondly, if you guys remember about A gradient, the alpha and atrial gradient, there will be VQ mismatch. There is anatomically and physiologically dead space. There is a lung capacity, residual volume, FEV1, guys. The air gradient was already known. The air gradient is going to increase. And PaCO2 remain unchanged because it is not having any effect or anything like that. But the partial pressure of oxygen is going to decrease. And you are going to talk about vacuum mismatch, and vacuum mismatch will be increased. Anatomically, a physiological dead space is going to increase due to restriction of alveoli. Lung capacity will unchanged. Residual volume will be increased. Forced expiratory volume will be decreased, and forced vital capacity also decrease. It is all about the lungs. And aging of respiratory system, there is the same thing. FVC will be decreased. Total system compliance will be decreased. And the chest wall stiffness will be increased and lung will be decreased. Due to which the total system compliance is going to decrease. And physiological dead space is also going to increase due to decrease in alveolar surface area. And that is also a reason there will be increase in alveolar and atrial rating. And there will be increase in vacuum mismatch. It's a very important diagram, aging of respiratory system. And you already talked, the dead space is going to increase due to decrease in alveoli. And this is about the compliance. Normally, the lung compliance is going to increase. Normally, what is going to happen? The compliance of lung is going to increase, but the chest wall stiffness is going to increase. Due to chest wall stiffness, the combined compliance is going to decrease because it is a sum of chest wall compliance and lung compliance. Due to chest wall, it is going to decrease, and it's all about aging. You guys also, for all the thing, you guys once go to the pathology, general pathology video of the aging that already present here. Thank you.